Welcome, my friend. Welcome to the Jafron Internal webinar. And today's topic is the Jafron publication update sharing. And first of all, I would like to say good morning, good afternoon, and good evening. And my name is Angie. And now let's start this internal webinar. So today's webinar will go through 4 parts. And in the first part, I will show you what's new. Totally, we will share 10 new publications today. And the second part will be the major part because we'll share the details of the publication. And then we will do some such as the forecast about the upcoming webinar. And also I would like to call on the create. So let's begin. What's news? So in the first part, I would like to emphasize again about the JF drive access. There is 2 methods that you can get through this JF drive because the JF drive we have the publication variable ones, and also we updated the related guideline, and also we add the hemoabsorption briefing on this, and later we'll outload the relevant the hemoabsorption briefing made by the Jafron. So one method is to click the link to get through, or to scan with the QR code from the telephone, whatever, which will, I hope this will provide you more convenience. So previously, I shared with our colleague, and maybe our regional colleague has shared with you a brief guide of how to explore the JF drive. It is quite simple. It will tell you how to search or to locate the publication of the JF drive, preview or download. I hope you have read this, and it's just quite easy to get through and to locate the publication and to find the related material on the JF drive. So today, since there will be 10 publications to be shared, and I made this musical stuff, and we can see that the HA-130 and HA-330, HA-280, and also the DPMAS, they will be shared in the publication today. So let's see. First of all, I make this publication briefing of each publication because I hope that this will provide you more convenience. That we can see on the slide that on this part is the title of the publication, and the blue one is the very brief, very simple briefing of this publication to share about their information and how the hemoperfusion, the Jafron hemoperfusion benefit patients, and each QR code is belong to the specific publication. So if you are just shake off this area, then share with the doctor, or then they can download by themselves through the mobile phone. So we can see that we have the 4 publications of the HA-130 and 2 of the HA-330 and 2 of the HA-280 for the immunoabsorption, and also 2 of the COVID-19. And actually, we all know that for this year, the COVID-19 is a very big topic, and it through everybody's life. So since now we already collect over 10 relevant guidelines of COVID-19 related with hemoperfusion therapy, and we outdated the one with the Jafron hemoperfusion cartridge mentioned in this on the JF drive that you can scan to find it, and also we follow the experts' opinion, their point of view, variable information. So we also updated on the JF drive, and it was from Professor Crowder Ronco, Professor Jim Vincent, and also Professor John Callan, so that you can also get through from the QR code to download it. Or I'm sure that most of you have already read, or because we have shared these guidelines and publications in the previous webinar. And also for some brief detail, you can search with this publication index of the Excel form that you can go through it to find, to locate each publication or guideline and to see what it's about, majorly about. And later after this webinar, I will send this publication index to you, and I hope that this will help you to better understand and for internal education for your colleague. Okay, now we come to the second part. We are going to share the 10 publications that detail and the benefit for the patients through the hemoperfusion therapy. So first of all, we are going to share the publication of the X-ray-130, and this publication was published on the blood purification this year, and it was from Vienna, and it was study about a combination of the hemodialysis with hemoperfusion and how it helped to reduce the cardiovascular related mortality rate. And the whole study have overall for 3 years. So we can see that the doctor, they believe that the high PTH will be a risk of the cardiovascular problem or bone disease, and they think that were related with the cardiovascular related mortality. So they evaluate the PTH changes in patients. So, and also to evaluate the patient's survival rate, so as to come out with their conclusion. So they enrolled 93 patients in the hospital and divided them into 2 groups. So in the study group, the patient received the hemodialysis plus the hemoperfusion as the combination therapy. There was 46 patients in this group. And in a control group, the patient just received the hemodialysis. But we need to pay attention that in this study, the patient who received the hemodialysis is the kind called low flat hemodialysis. So in the control group, the patient that received the low flat hemodialysis treatment for a frequency of 3 times a week. And in the study group, in the combination group, the patient that received in the first month, they received 1 hemoperfusions once a week, and then in the second month, the patient that received 2 times of hemoperfusions in the second month, and start from the third month, they received 1 hemoperfusions each month. So until the end of the endpoint, which is the 3 years of therapy and study. And they used the X-ray-130 hemoperfusion cartridge as to combine with the hemodialysis. So during the treatment that the patient they received the combination therapy with the hemodialysis plus the hemoperfusion for the first 2 hours. And then after the 2 hours, the combination therapy, that the hemoperfusion cartridge will be removed and the hemodialysis will continue until another 2 hours were finished. So let's look at the result. That from this table, we can find that there was a significant difference in the serum phosphorus, beta 2NG, and IPTH, and also the urine and the criterions in the combination group, and compare with the hemodialysis group. And according to the publication, it was the data was showing the significant difference. And also no different of the white blood cells and red blood cells, and also the hemoglobin. They're different of this shows between these two groups, which shows that there was a safety of the combination of this hemoperfusion plus the hemodialysis therapy. Moreover, we can see about the IPTH and the beta-2-NG's changes that we can see these two lines, the red one and also this blue one, that in this combination therapy group, and there was a significant reduction of the level of the IPTH and also the beta-2-NG. While we can see that there was no reduction but increasing of the PTH and also the beta-2-NG in the hemodialysis groups. And this data was showing the significant difference. And moreover, for the survival curve, the patients in the combination group, they showing a better survival situation comparing with their hemodialysis groups. So the Dr. Tay made a conclusion that the combination of the hemodialysis and hemoperfusion for 3 years can reduce the cardiovascular related mortality rate. So now we come to the second publication. Is about combination of the hemoperfusion plus the hemodialysis to how it benefits the early morning hypertension in the hemodialysis patient. So in this study, there was 76 hemodialysis patients, and they were randomly divided into 2 groups, which means that in each group there was 38 patients. So the patient, the early morning blood pressures was collected, evaluated, and compared between these 2 groups for 12 weeks with treatment. So we can see that in the treatment group, the patient, they received the sequential blood purification treatment, and they received hemodialysis plus the hemoperfusion, and hemoperfusion was started on the 2nd week, combined with the hemodialysis, and it was once a week. And this combination therapy was last until the 12th week of the study. So we can see the result that first of all, in the baseline, there was no difference in the control group and also the combination therapy group, both in the systolic blood pressure or the diastolic blood pressures. So after the 12 weeks of their therapy, the blood pressures, we can obviously find out that the blood pressures in the study group was presenting a huge reduction comparing with the baseline and also compare with the control group. And it was a significant difference. So the doctor, they came out with a conclusion that this use of the sequential blood purification, which is a combination with the perfusion with the hemodialysis, it can significantly reduce the early morning blood purification, to reduce the early morning blood pressures of the patient, and it was the promotions in clinical. The third publication was published on their domestic academic conference as the abstract, and it was about how the hemoperfusion helped the patient to improve their sleep disturbance and also their survival in the maintenance hemodialysis patient. So totally, there was 280 patients undergoing the routine hemodialysis therapy, and there was 18 patients receiving their hemoperfusion plus the hemodialysis therapy. And also for the evaluation, they collecting the data of the sleep disturbance and also the sleep efficiency and also the survival rate was evaluated. Let's look at the result. Here is let's look at the table on the right side. That we can see that after 2 years of the hemoperfusion therapy, that the sleep disturbance and also the sleep efficiency was significant improve comparing with the control, comparing with the baseline and control group. And also, it was revealed that the first hospitalization was significantly lower in the combination therapy group, which is the patient.
डायबिटिक पूरा डायबिटिक ऊपर से हाइपरटेंशन ऊपर से कोई परहेज नहीं तो हम लोग हमेशा डरते थे इसको
Okay. So also for the survival rate, they evaluate the survival rate and found that in the hemoperfusion plus the hemodialysis group, there was a significant higher survival probabilities comparing with the hemodialysis groups. And finally, the doctor, they collecting or the doctor and enroll more patients and finish this study and make her. Sorry, may I help you? Okay. And they finished this study and published on the Internal Journal of Artificial Organ journal, that we can see that the inflammation situation and also the itching situation and also the patient survival rate and also their sleeping situation was improved by their hemoperfusion in the therapy. And this publication is quite an interesting one and interesting one last year. So the last publication of the H130 is quite interesting because it studied about a few field that we don't always reach. It was talking about the effect of the different dialysis method on the microbiotas in the uremic patients. So in the study, the doctor, they enrolled 85 patients undergoing the hemodialysis, and all these patients, they are undergoing the same treatment plan for over 12 months, and they were divided into 4 groups. So they have group 1, the patient that received hemodialysis, and group 2, the patient that received hemodialysis and the hemodiafiltration, and in group 3, the patient that received the hemodialysis, hemodiafiltration, and also the hemoperfusion. And also there is a group enrolled with 24 SRD patients, and it was called CK group. So in this study, a lot of parameters were evaluated, such as the patient's serum biochemical, and also the EGFR data, and also the patient's dialysis adequacy, which is called KT/B, or data were collecting, and also they analyze they collect factors of the patient, and so as to analyze the influence of the different blood purification measure on the patient's intestinal flora. So it was shown from the publications that the group C, when patient they receive with the hemoperfusion, they show a lowest CRP level after their study, and also comparing with all the such as group AA, group B, or the CK group with the 24 ESRD patients. And also there was no significant difference of the KD over B between the group 1, group A, B, and C. And there was no significant difference in the eGFR between 4 groups. And also another is that the sepsis diversity of the group C, it is significantly higher than that of the group 1, group A, and group B. And also their how to say, the bacteria, the microbiota situation in the group C is much more better comparing with group A and group B with different distribution of the intestinal bacteria. So the doctor, they think that the intestinal microflora can improve by the uremic and might be affected by the blood purification method. And also they wanted to further to study this area so as to explore the uremic from different perspectives to help to push forward the clinical development. So this publication is quite interesting and rare to see, and we think this can open a new perspectives to let us to know more about how the hemoperfusion can benefit patients in different areas, such as the intestinal situation. So now we come to the HRA-330. We have 2 publications of the HRA-330, and the first one is about the sepsis sort. It was published this year, and in this study, they enrolled 30 patients, and they were divided into 2 groups randomly. And in the therapy group, there is hemoperfusion plus the post-high volume hemofiltrations, and we are 15 patients. And in another group, the patient they just received the CVVH. So a lot of the parameters were evaluated, such as the Apache 2 and the SOFA score, and the biochemical changes of the patients, and also they are in the cytokine level, and also the patient's hemodynamics was analyzed according to the vasopressions, and what's more, the 28 days mortalities was compared in these 2 groups. So we can see the result shows that according to the vector size and also the other parameter that we found in these 2 groups, they both shows the reductions, improvement of this parameter in both groups. But we can see that the hemoperfusion plus the post-high volume hemofiltration was more efficiency comparing with the CVVH group, such as we can see here the CPRs, the Apache 2 score here from 22 to 30.5, and this is in the CVVH group. The Apache 2 was from 21 to 17. So, and also the same in the SOFA score. The reduction of the SOFA score is much more larger comparing with the CVH group, and this happens such in the data such as the heart rate and the white blood cells and the PCTN and so forth for sectors. And also for the hemodynamics, there was more reduction in the hemoperfusion plus post high volume hemofiltration group comparing with the CBBS group with significant difference. And what's more, for the cytokine level, after the 24-hour, we can see that all the, such as interleukin 10, interleukin 6, and TNF alpha, in both groups, they all have the reduction. But their hemoperfusion plus the post-high volume hemofiltration group, it shows a much more significant reduction that we can see compared with the black one comparing with the gray one. So especially after the 2 hours of the hemoperfusion, there was a more significant reduction in the cytokine with significant difference that we can see the start here. It's a symbol of the significant difference. And also, according to the study, the combined combined therapy with the hemoperfusion and post-high valence hemofiltration, it shows a lower mortality comparing with the CBBS group. So the doctor, they made a conclusion that the hemoperfusion plus the post-high volume hemofiltration was a safe and effective blood purification method, and it can benefit the patient largely in the aspects such as maintaining the hemodynamic and also the balance their hemostasis, and so as to reduce their inflammatory situations. And they also mentioned that this combination blood purification methods, it could be a candidate of the treatment for the critical disease, such as for sepsis, severe acute pancreatitis, or MODS, etc. So this publication of the HA330, actually it's our published on academic conference this year in Abu Dhabi, and it was published as the abstract. And I think maybe you were similar because this is from Philippines, from St. Luke Medical Center. And yes, actually last month I shared with you as the poster published on the CREATE collection. And actually in the very early, the doctor, they submit this case to the CREATE project, and also they published this on their international academic conference, and was selected again by the CREATE project as a poster. So there was the forecast here that the next CREATE webinar now is under planning. We are also collecting cases. We are edited cases and communicate with doctors and other partners, and we are planning to hold another CREATE webinar in October. So let's looking forward with that. So now we have the two publication of the HA280 for immunoabsorptions. And the first is a case report, is about the immunoabsorptions with the HA280 on a case called neuromyelitis optical burners disorder. So in this case, the patient lost the vision of the left eyes totally, and with their traditional medications therapy, there was no improvement. That we can see these figures that the patient receiving the medication, and there is no improvement of the visions. So at this time, the doctor to conduct the HLA-280 immunoabsorption therapy for the patient, and we can see that right after that, the patient was able to see line and gradually to get an improvement of the visions. And totally, this patient received just several HLA-280 hemoperfusion therapy. So it makes out the conclusion that the HLA-280, the immunoabsorption therapy, could be a potential alternative, and also very important, the cost-effective treatment for the steroids, the resistant neuromyelitis optica burners disorder. So we are surprised with this case, and also we talked with this doctor because it was from China, and we are also surprised with these outcomes and quite satisfied with this. And another publication of the HLA-280, actually it was another an English abstract published on their internal, the domestic journal, and it was about to evaluate the short-term efficiency and safety of the HLA-280 immunoabsorptions for the polymyositis. So in this study, they have 72 patients. Only 22 patients, they were treated with the HLA-280 immunoabsorption therapy, and each patient, they received 3 types of therapy. And another 50 patients were treated with only drug, so they were enrolled in the control group. And they evaluate a lot of the parameters such as the clinical symptoms and signs, and also the autoimmune antibody, and also some enzyme and the inflammatory markers, etc. And we are quite surprised result that in the first one, that the symptom and sign are improved with their HLA-280 significantly, and also the clearance of the autoantibody and the myocardium, the enzyme spareness, and also the inflammatory markers such as ESR and or the CRP, and also the immunoglobulin was more efficient in this immunoabsorption group significantly. And also when they check with the lung CT scan and show that in the immunoabsorption group, the patient shows improvement in the pulmonary lesions after 3 months throughout significantly. And most important, quite more important, that there is no severe adverse reaction occurs during these observation periods. So the doctor, they came out with the conclusion that the HLA-280 immunoabsorption therapy can significantly lead to help to clear the auto antibodies, and also the muscle enzyme, and also the inflammatory markers and immunoglobulin, and to improve the lab image of the patient for short time. So it could be a safety treatment for the patients with polymyositis. So the last two publication is of the COVID-19, and this one I think most of you are quite familiar with. It was from Iran and published on SCI journal, and it was using the HA380 so as to combine with the CRT to effectively to improve the patient's renal function and also the respiratory function with the patient with severe COVID-19. And also it helped to regulate the patient's immuno and inflammatory response. And finally, this patient, after 3 sections of the HA318 hemoperfusion plus the CRT therapy, the patient have the gradually improvement, and finally was the discharge from the ICU. And the last publication of it was of the COVID-19, and quite interesting is using the DPMAS. As we know that the DPMAS is especially for the patient with hepatitis failure or hepatic dysfunction, and according to the expert point of view, that the organ cluster was obviously seen during COVID-19, and maybe firstly the patient was attacked on the lung, but then the patient's the renal and or their liver well cannot with the injury. So in this case, even though the patient was just with mild the hepatitis the dysfunctions, but he was diagnosed with COVID-19. So at the same time, the patient was observed with the increase of the different kinds of the cytokine, and it seems that the patient the cytokine level was increased and reached to a point called the cytokine storm. So at this time, after Thursday in the hospital, the patient received the DPMAS after hemoperfusion therapy, so as to control the cytokine storm and to protect their hepato function. So we can see this complete figure here that it is quite magically that right after here is the day 13, 14, and 15. This 3 day is the 3 day that the patient received the DPMAS therapy, and just right after this 3 session of therapy, all these cytokines and also the inflammatory parameter, they have a great reduction. And then the patient was transferred to the ICU for more intensive care, and gradually get an improvement. And after several recheck with this the nucleic acid test, that they make sure that this patient was recovered from the COVID-19, and he was then discharged from the hospital. So in this publication, that the doctor think that this the prolonged prognosis of this the critical care with the COVID-19, it might be improved if a timely intervention of the extracorporeal blood purification, such as the DPMAS, was performed. So till now, I already finished this 10 publication sharing, and very briefly, I would like to share with you the upcoming webinar. In next month, on September 3rd, we were holding the first webinar on the cardio surgery. So I would like to invite you to register for free, and also to share this information with doctors, with cardio surgeon, with nephrologists, any doctor who are interested in this, and then we can enjoy this webinar together, and so as to discuss with the doctor at the same time. And also on September 17th, we will participate the ISICEM Academic Conference, and we were invited Professor John Callens and also doctors from Australia and India to share their valuable experience of hemoperfusions clinically. So time will be updated soon, and I would like to invite you to pay attention and join us next month. So the last one, again, I would like to say it again that the next Create webinar is under planning. So I hope to see you on October. And also, if you have any cases from doctors, or doctor have the plan to submit any cases for the Create, you're very welcome. And if you need any help, you can let me know. So because this is the Create is a very basic project, so to collect the case, and based on this, we will gradually to create evidence for more powerful evidence. And we will launch other projects, such as the single center clinical study projects or others. And the detail will be shared with our regional colleague, that you can talk with them to know more. And this is my email. The first one is for the clinical support. If you have any questions or doubts, or doctor has any a requirement for a clinical support, they can submit any question to the support email. And if you have any question to me, or for this webinar, or the Create project, or any clinical study, you are welcome to send any information to me. This is my work email. So also I would like to invite you, so as to invite doctors, or to follow us on our social media of LinkedIn, Facebook, Twitter, and also our JF Drive. So I think I finished today's webinar.